In this video, we will look at public health reforms, acts and local initiative in the industrial period 1750 to 1900. So a key point to remember then, there was a change in attitudes of both central, so national and local government towards public health. As a result, several pieces of legislation, so laws, were passed which represented significant progress, particularly the 1875 Public Health Act. So Chadwick's report. So changes to central government and the 1848 cholera epidemic. So Edwin Chadwick's 1842 report, The Sanitary Conditions of the Labouring Population of Britain, challenged the government to introduce reform to address the appalling poverty that many industrial workers lived in. Chadwick suggested that a national public health authority be set up which would force local councils to act to improve the public health by providing clean water and a sewage system. Laissez-faire was being challenged. Water company bosses objected to Chadwick's proposal because they thought they might affect their profits. The local taxpayers also objected to Chadwick's proposals because they did not want to pay more tax. And the cholera epidemic triggered the 1848 Public Health Act. So let's have a look then at this 1848 Public Health Act in a bit more detail. So you could argue that it was a limited step forward, but it did show signs of progress in public health. So for example, the Act created the General Board of Health. The government could force local councils to make public health improvements. Councils were encouraged to have a medical officer who would oversee local health issues. And we do start to see the beginning of this laissez-faire approach being challenged during the first Public Health Act. However, on the other side, there was limitations to this. The governments could only force local councils to make improvements if the death rate was higher than 23 per 1,000. By 1853, there were only 163 places with a local Board of Health. The General Board of Health was abolished in 1854, so there was limited long-term impact. And there was still no government minister for public health as well. So, Public Health Act, it was a step forward in terms of challenging the laissez-faire approach. However, it was very limited. It was permissive. It was not compulsory unless you met the criteria of the death rate being higher than 23 per 1,000. So let's have a look then at these different reasons and what helped to speed up reforms. So the first one is the Great Stink. So in the summer of 1858, it was scorching, right, in London. The River Thames dried up so much that the smell of sewage from the river became unbearable. To kill the smell, the windows in the House of Commons were draped with curtains soaked in chloride of lime, but it was still impossible for MPs to continue with their debates. The MPs decided that something had to be done about London's sewage problem. They turned to the chief engineer of the Metropolitan Board of Works, a man called Joseph Bazalgette. And between 1858 and 1865, Bazalgette built 1,300 miles of sewers across London. It was a remarkable achievement. It was a really, really significant improvement in public health. And what it did is it prevented the spread of waterborne diseases such as cholera and typhoid. It had a huge impact on people's health. 1860, the Pure Food Act, sometimes called the Adulteration of Food Act. So there were no laws to protect people from eating unhealthy food. For example, bread was often made with a combination of flour and potassium sulfate. So let's have a look at what happened here then. So the first law to try to prevent the contamination of food, it provided for the appointment of food analysts, and it was this another kind of blow to laissez-faire, another step away from a laissez-faire attitude. The limitations of it: only 7 analysts were appointed. There was no compulsory inspections of food. So again, it's at that theme of what's compulsory, what isn't. And where we see things becoming compulsory, that's where we see the biggest change. And the Act was soon ignored. It was revised in 1872 and eventually replaced by the 1875 Sale of Food and Drugs Act. 1861, we've already discussed this one, the Pasteur's germ theory, where he proves that it's bacteria, it's germs that cause disease, not miasma. 1865, we see the opening of Basil Jett's new London sewage system, where we see waterborne diseases become a thing of the past. It was a revolutionary invention that improved the public's health of London immensely. 1866, the Sanitary Act. So the reason why this Act was passed was, a cholera outbreak and the need to make local authorities responsible for public health, and that's what led to this development. So it forced local authorities to take action to provide fresh water and sewage and waste disposal. All houses had to be connected to the main sewer. It defined what we meant by overcrowding as well. If local authorities did not carry out the work, they were billed by central government, who did it for them. The central government who did it for them. And again, another blow to laissez-faire. There was a limitation to this. The Act was clumsily worded and was slow to be put into operation. 1875, Sale of Food and Drugs Act. So there were still some basic food quality problems which needed solving, and harsher punishments were needed for those who continued to break the law. So this act improved the quality of basic food. It introduced harsh sanctions for people for food adulteration, and local authorities were given the power to seize unhealthy food. 1875, we also have the Public Health Act, the second one. This was really significant. So the 1867 Reform Act meant that working class men were now voters, so their views had to be listened to. So that's one of the main reasons for this reform. And in terms of progress, local councils were forced to clean up towns and provide clean water and proper drains and sewers. A medical officer had to be appointed by local councils. Sanitary inspectors had to be appointed, and this led to massive improvements in public health. We also see in 1891 the slum clearance in Spitalfields. So there was a need to clear out the overcrowding, unhealthy slum dwellings. This is in Manchester. And the newly established, in London, the progress here. So newly established London County Council ordered the clearance of the overcrowded Old Nickel slum, and new modern 3-room tenements, so buildings, were built. So the end of laissez-faire was over, and it was generally accepted that central and local governments had a responsibility to protect the health of the people. So a huge shift and change in people's beliefs and attitudes during this time period. So 1875 to 1900s, these beliefs grew even stronger, where they believed that the government had a responsibility to protect the health of the people. And we see this in various ways. So first of all, the Women's Cooperative Guild. So by the end of the 19th century, working class people were forming political and industrial organisations which demanded change. One of these was the Women's Cooperative Guild, which held its first meeting at Hebden Bridge in 1883. The Women's Cooperative Guild campaigned to improve the political and legal status of women. It also fought for government action in health matters such as maternity care for pregnant women, free school meals for poor children, better housing, and clean water. Women were becoming a powerful force in the campaign to improve public health. Also, my last couple of points is this idea of civic pride. Right, so a town having pride in its local area. So pride in clean water and new housing. So again, towards the end of the 19th century, mayors and councillors in many parts of Britain began to spend huge sums of money on building schemes which demonstrated the power and prosperity of their towns and cities. They built magnificent town halls, squares, shopping streets, art galleries, concert halls, libraries and museums. Another expression of this civic pride was the money which some local authorities spent on huge engineering projects to bring clean water to their town or city. And by late 1870s, Manchester was still without an adequate supply of clean drinking water. So the Manchester Corporation drew up a plan to dam Thirlmere Lake in the Lake District, raise the level of the lake and construct a 96-mile aqueduct to carry water from the newly created reservoir into the centre of Manchester. Parliament approved the Thirlmere water scheme in 1879. It was a massive engineering project which took 3,000 men 8 years to complete. The first water gushed out of the specially built ceremonial fountain in Albert Square, Manchester, in October 1894. By 1900, water schemes across Britain meant that nearly everyone had a constant supply of clean drinking water piped to their houses. There was also civic pride in new housing. So another expression of civic pride in the late 19th century was the construction of local authority housing which provided people with decent homes. In 1885, Manchester Corporation began to demolish some of the worst slums in the city. Manchester and other cities had made a start on improving people's housing, but there was still a long way to go. By 1900, nearly everyone in Britain had clean water, but not decent housing, good food and clean air. These problems and some totally new threats to people's health would be the challenge of the 20th century as well.